COVID-19 cases are on the rise since January, according to federal surveillance. There were 10,000 hospitalizations in the first week of February, a 60% increase over the course of the last month. While cases are not at the same levels as the pandemic, the patients who require intensive care have remained relatively the same over the past year.
COVID is still here, like it's been here throughout.
The group at the most risk is still seniors, with their hospitalization rates being the highest.
It's probably not going to go away.
Hospitalization rates seem to be higher in southern states, including Florida, Alabama, and Louisiana.
I'd go a whole 12-hour shift without seeing any. And then in the last, 1 to 2 weeks, we see 3, 4, 5, 6 COVID positive cases coming in.
While the rates are increasing, they are still sizably smaller than their pandemic predecessors.
1% of hospital beds are being used for COVID-19 patients, while 20% of hospital beds were being used during the pandemic.
However, recent data has become less representative of potential infections because of decreased lab testing and an increase in asymptomatic infections. Along with that, in most of the country, less than a third of citizens are up to date on their COVID-19 vaccinations. Overall, weekly COVID-19 hospitalizations are still 90% lower than they were during the pandemic. Reporting for Titan News, Julian Vallejo.